Good morning, Sentinel City. So, for today's presentation, we're going to be talking about a topic that not many people talk about, and that's okay, but it's about gonorrhea. Gonorrhea is a sexually transmitted disease spread through anal, vaginal, and oral sex. It's spread through the bacterium Neisseria gonorrhea, and it can affect both men and women.
Hi, reporting to you live from Sentinel City. My name is Sherry and I am here to report to you about gonorrhea and address how this disease could become a global health issue and what might cause this disease to spread from the United States to other countries. So, as we all know, gonorrhea could become a global health issue because anyone who is sexually active can get it. It is more common among teens and young adults, aged between 14 to 24. Many people who have it don't even know that they have it, especially women, because this disease often has no symptoms. You can even pass it to others without even knowing. This can be cured with the right treatment. If you don't treat it, then it can lead to other serious health problems, and you know you don't want that. There have been several reported cases of resistance to cephalosporin antibiotics, which is the last treatment option against gonorrhea. So pretty much the bacteria has mutated and learned how to become resistant to the antibiotic, therefore no longer curing this STD. Every year an estimated 106 million people are infected with gonorrhea, and that is sexually transmitted. So gonorrhea can spread from the United States to other countries if you don't use a condom, to help lower the risk and or if you don't get tested or treated. Overall, if you think you have gonorrhea, be sure to tell your recent sex partner or partners so they can be tested too. Talk openly and be honest with your partner. Thank you.
Good morning, everyone. So we're going to talk about strategies to decrease your chances of spreading gonorrhea. So how is it spread? I know it's been touched on before, but the number one way it's spread and the only way it's spread is through sex. So if you abstain or don't have sex, then it couldn't get transmitted. But you're asking me, Nurse April, can I have different types of sex? Let me give you an example of what I mean. For example, I have my trusty friend Prince here. So, gonorrhea is spread orally, no oral sex. It can also be rectally, no anal sex, and that can be men or women. Let's just say you're an adult and you're sexually active. What can you do to decrease the fact of spreading gonorrhea? Well, you can practice safe sex. What that means is limiting your number of partners that you have sexual relations with, and also having safe sex. So using condoms, things of that nature. Say you don't want to abstain from sex. It's okay. I understand, we're all adults here. What's another way that I can do to decrease the likelihood of me spreading this disease to others? Well, you can always practice safe sex. And for that, I have an example. This can represent a penis, and this doggy bag can represent a condom. So prior to sexual activity, you want to make sure that the condom that you use isn't expired, is well lubricated, and a good reputable company. And then you simply just want to place the condom from tip to shaft over the penis. By doing this, covers the bodily fluid exchange between male and female, or male and male, or you can also female to female if they use a vaginal condom. Another great way to decrease the spread of gonorrhea is getting tested regularly. So although you might be in a committed relationship or you might not be in a committed relationship, it's great to be tested at least twice a year. So Nurse April, what are some signs and symptoms that I might have gonorrhea? Well, according to the CDC, little to no people show signs that they actually have gonorrhea. But if you do have symptoms, here are some symptoms: abdominal pain, cramping. Also, you'll have a green discharge coming from the tip of the male penis, or it can also be discharged through the female vaginally. And so these are signs that you want to look for. Other signs include painful urination, vaginal bleeding between periods, also pain or swelling of one or two testicles. So these are signs that you may want to go see your doctor. Something is definitely abnormal here. And so by doing that, we'll decrease the spread of gonorrhea. Last tip to decrease the spread of gonorrhea is if you are diagnosed with gonorrhea, don't worry, it is treatable. So you go to your provider and you get treated with antibiotics. Make sure you take the full length of the antibiotics for the complete duration of the treatment. By doing so, verifies that the bacteria in the system is completely taken care of, that is completely destroyed. If you don't take your antibiotics, if you stop taking it halfway through, or you think that your signs and symptoms are gone, so you stop taking it, it can cause the bacteria and infection to grow back into your body. So make sure if you are diagnosed with gonorrhea that you take your medication the full duration as the provider described it in the medication.
According to CDC, any sexually active man who is gay, bisexual, or have sex with men should get tested yearly for gonorrhea. According to CDC, if you're a sexually active woman younger than 25 years old or an older woman with risk factors such as new or multiple sex partners or sex with a person who has sexually transmitted diseases, you should be tested yearly for gonorrhea. Also, according to CDC, if you are pregnant, it is important that you talk to your healthcare provider so that you get the correct examination, testing, and treatment as necessary. Treating gonorrhea as soon as possible will make health complications more or less likely for your baby. Lastly, if a person has been diagnosed and treated for gonorrhea, he or she should tell all recent anal, vaginal, oral sex partners within 60 days before the onset of symptoms or diagnosis so they can see their healthcare provider to be treated.
According to data from Planned Parenthood, gonorrhea is one of the most common sexually transmitted diseases for people in their 20s. You may also know it as the clap or the drip. What people may not know is that there are other ways gonorrhea can be transmitted besides through ejaculation. For example, gonorrhea can still be spread through pre-cum, so it's always important to wear condoms and use proper protection. Gonorrhea can also be transmitted if the male partner doesn't insert his penis completely into the vagina or the anus. You can still be infected if your partner only inserts their penis halfway. So it's always important to use protection. And because of how mild the symptoms are, like said before, you may not know you have gonorrhea, so always get tested.
Hello, today I'm going to talk about ways gonorrhea can affect the city you live in. Gonorrhea can affect any person from any racial background, culture, income level, and religious group. So that's why it's important for those who are at risk in your community to be aware of symptoms and to practice a healthy sexual habits, I should say. So who's at risk? Everyone, but especially women and their unborn baby. The bacteria loves to hang out in the reproductive system and causes a number of problems that can cause a woman to miscarry, have a stillborn baby, an ectopic pregnancy, which means a baby can grow outside of the uterus, which is very dangerous for mom. Or a newborn can have a low birth weight, or also the mother can transmit the bacteria to her unborn baby. So this can cause neurological damage, which means that the baby or a person can have hearing, seeing, speaking, and learning problems. More importantly, it can lead to cancer and death. If the number of people in your community are getting gonorrhea and the incident rates increase, then it can cause medical bills to become more expensive due to using more expensive medications to fight off the infection. Traditionally, penicillin was the antibiotic of choice, but with gonorrhea getting smarter, it's getting harder to fight the infection. So what can we do about preventing gonorrhea and other STIs in our community? You can contact your local CDC or go to their website, visit Planned Parenthood, go to your local doctor's office, go to your local health department. You can also visit your local WIC office, which has brochures and pamphlets on STI information and prevention. You can also contact the STI referral number, which is 800-232-4636. And my personal favorite, go to your local library. The library card is free. Staff is available to help you search the internet and use useful information, resources, and you can also find an array of information on STIs and on gonorrhea especially in any language that you prefer. So with this information, you can use to help your family and your friends. And the number one thing is you want to prevent this infection from happening in your household, in your community, and protect your friends and family and the ones you love the most.